a more than $630 million investment into global best practice health services for the Macarthur region. But to be able to come here now and experience 12 stories of our clinical services building, which will provide services, health services, critical services to the Macarthur region, is a very exciting prospect.
As you turn off the motorway now, or even on the motorway, you can suddenly see the most amazing sight, which is Campbelltown Hospital, 12 levels of incredible 21st century health facilities. This hospital will make a huge difference for a growing local community. We can have the best of the best in terms of new nurses and of course the existing medical staff working, but they need the tools to be able to work with.
So this new emergency department is going to have some amazing new key features. It's going to be increased capacity, so more than double the size of the emergency department, more than double the size of the short stay unit attached to it, and then special areas such as aged care, mental health, paediatrics, fast track, which is all going to provide what the patient needs at the time. The design helps patient flow by having lots of features. So we have the resus room coming straight off the ambulance bay. We have some central connecting corridors so that patients have forward motion from triage through to their specific area and then on to their destinations. We have satellite imaging in the middle of the department so that patients don't have to travel far or for any length of time to getting their CT or their X-ray done, and so that our staff don't have to leave the ED ever when transporting people through that diagnostic phase. Then later this year, because the emergency department is going to be finished long before some of the other levels, the staff are going to be coming into the emergency department and doing simulations in their resuscitation care or in using all the different sections so that we're intimately familiar with the new clinical space on day one when we move in next year.
We've wanted to ensure that our process has been inclusive, so we've had lots of ways for people to become involved through workshopping, involvement in our design process, through our arts and culture strategy, and also involvement for the community in developing new models of care for use in our new spaces. Across the span of 2021, we're working hard to deliver some new departments across the campus. We'll be delivering a brand new clinical information department, an expanded pathology service for the site, and for the first time ever, a brand new dental clinic on site at Campbelltown Hospital. So we're already working hard on a plan to move our current services into their new locations in the new building. We're making sure that we plan to do that in a way that doesn't disrupt current clinical services to our local community. There's a growing level of excitement here within staff at Campbelltown Hospital as they begin completing workshops to plan to move into their new spaces. They're experiencing walks through the new clinical services building. Even though the departments are partially completed at the moment, they're starting to get a sense of the look and feel of the new environment, and it allows them the ability to plan their new workflows.
I think the community is going to be very proud of this redevelopment. I think that they're going to see the new building, the new emergency department, as such a large feature on the Macarthur landscape, and I think that's going to fill them with a great sense of regional pride. I think more than that though, they're going to be able to see the new services and themselves and their loved ones getting care close to home and particular needs that are being addressed, such as the additional mental health beds. That's a long held need, and we're going to be meeting that at a much greater level in this new facility.